Guys, what's going on? It's Dr. G here. I want to talk to you a little bit about myofascial release, self-myofascial release, foam rolling, a lot of different techniques. Especially after a run, after working out, you feel these tight muscles, especially with runners, weightlifters doing squats, deadlifts, things to that nature. There's a few areas you want to focus in on, so we're going to focus in on the lower body today. First thing I like to do when I get on this foam roller is just to sit on it. Just get in there, work on those glutes. Now, it's going to be very painful, especially if you've never done it before. So, I recommend people kind of go easy your first few times because you will have some soreness, but soreness isn't bad. So what we're trying to do is go in and break up muscle adhesions, which essentially can develop into scar tissue, which can create other types of issues down the road. So as you can see, I'm just kind of rocking back and forth. Myself, I like to get a little bit more pressure, so what I do is I cross my leg over, and I really try to get into that glute. Now, this is also good for people that have piriformis syndrome that may be creating a sciatica type of issue. So I see a lot of patients that have that. And I just stay on it just 15, 20 seconds. The next thing I like to do in this position is go actually down to my back and just roll on those lumbar muscles. That'll really help with back tension, back pain, things of that nature as well too. Now when I'm here, I go ahead and I place it on the IT band. Now this one is one of the most painful ones that you can do. What I like to do is cross the leg over again. I like to keep my bottom leg up in the air and just slow movements here. And you want to go all the way down to that insertion point on the knee. Now that's going to be the most painful for most patients that they're doing this. My next favorite one to do is actually to get on the quadricep. Now in this one, I'm just raising the leg straight up in the air once again, getting on those insertion points, and then going all the way down to the knee. Now you can also do your lower leg with this as well. Just crossing the leg over, lifting up, and just rolling. And you can kind of turn the foot, you're going to feel a different area. I like to do this daily. Of course I'm showing a lot of patients, so I have an excuse to do it. I do recommend doing it at the gym. Some people like to do it before, some people like to do it after. I do it before and after, so I'll leave that up to you on that one. But I use the proper foam roller. One of the reasons I like it is because of the groove in the middle. You can actually do it on the spine. It doesn't create a lot of pressure. I've seen people use PVC pipes. I've seen people use just your regular basic foam roller. Any of them will work. If it's your first time doing it, you may want to try starting with a softer one and then building up to maybe the PVC pipe. Now, you can also do this with tennis balls, lacrosse balls, massage balls. They make a whole slew of different things for myofascial release. Thanks for watching, guys.